Hello everyone. Today in our series of Docplexus KOL interviews, we are honored to have with us Dr. B.S. Ajaikumar. The man does not need any introduction at all. He has set up a model for affordable healthcare through HCG. So can you please elaborate on the HCG model of healthcare?
We believe in cancer care, particularly, which is supposed to be very expensive. One of the most important thing is making it accessible, which becomes also affordable because of the people don't have to travel long distance, particularly when cancer care is a long, prolonged therapy. So when you set up a center in places like Ranchi, Cuttack, Nasik, or Vijayawada, Angol, really, we're putting in high quality centers close to their home, which actually makes it very affordable for them. Not only that, HCG model is a believer in cross subsidy. People who can afford to pay, and those who cannot afford or come to the lower socioeconomic group, either we participate through the government schemes or we have our own foundation and medico-social workers assessment where we treat patients at a subsidized or a free care. This model has been very successful, and also the important thing is you are giving the right treatment to the patient. I always call it, talking about only low cost, there is a cost of low cost. One has to be very concerned about. If you do not treat the patients properly in the guise of low cost, when there is a recurrence and morbidity, mortality is high, who is going to pay for it? The cost to the family and the patient actually becomes more when the patient is not treated properly because of this talk of low cost. So cancer care is very complicated, very personalized, and has to be dealt in a proper way to get better outcome. That can be achieved only by not compromising on the quality of care. So we have to set up models which can cater to quality of care, outcome, at the same time have a system to take care of the needy patients. And make it accessible near their hometown, which I think is the model we've taken it across the country and even to Africa today to see that we can win the war on cancer.
So definitely it's the need of the hour to provide best quality of care at affordable prices. So how easy was it for you to replicate this model of healthcare?
No, it is not difficult because people were afraid that India being a quote unquote poor country, when you go to tier 2, tier 3 cities, people will not come for high end care. What we have found is rich or poor, what they want is good quality of care. We also believe that, because of the lack of awareness, people will accept any kind of care. Our role is to educate the public, the people, what is the right care, how it should be delivered, and at some point address the cost issues also and cross subsidy. When India is the cheapest healthcare provider in the world today, our drug costs, our costs for investigations, even high-end therapy are far cheaper in the world. We've been bringing the same technology and treat. How we have innovated this model is being studied across the world. So we should be very proud of what we have achieved in making particular disease like cancer care accessible and affordable. Of course, we all know the per capita income of the individuals has to increase. But while we have 250 million people who are in middle, upper, and affluent caste, cross subsidy may be an answer, and government funding with lot of schemes may be an answer. This is how we can bridge the gap and make it a successful project to take cancer care across the country.
Definitely, sir. We are proud to have that. So, what do you think can be role of online digital media in spreading awareness about such
Yeah, I
causes?
think what we have to really spare to the online is not to fear cancer. I know in the historically people have feared cancer because people came in advanced diseases because they did not recognize the early symptoms of cancer and they were afraid. Cancer means people thought death sentence. People were already worried about the cost. What we are trying to say is cancer can be a chronic disease like other diseases such as diabetes. You properly identified and treated at the proper stage. Even follow-up is important. If the cancer is detected early, if something is coming back, it can be properly treated. So digital media can play a huge role, particularly in the middle class families, to increase this awareness, which is a huge population. and eventually our goal will be to see how we can bridge the gap even to the lower socioeconomic group, particularly since a lot of people are becoming educated. Even rural India is moving towards education. I think the digital media will have an enormous impact on creating this awareness.
Thank you so much, Dr. Ajaikumar, for joining us. Thank you. To stay updated on our latest scale videos and interviews, please follow us on Twitter, like us on our Facebook page, and subscribe to our YouTube channel. Happy Docplexing!